My dear students, welcome to my YouTube channel. In this platform, I am going to discuss about various study related to pharmacy. So this is an initiative to start e-learning process to help other students to share my views in the social media and platforms. So let's start. Today I will discuss first about pharmacokinetic, the basic considerations. So in this, as you know, this pharmacokinetic is one of the important aspect in the design of a dosage form. So, fundamental of this pharmacokinetic principles is very much important. So let's start. We will discuss. So in this process, we are going to discuss about the introduction to pharmacokinetic, then plasma drug concentration time profile, then come to pharmacokinetic parameters, and different pharmacokinetic parameters like Cmax, Tmax and area under curve. So let's start. So coming to this pharmacokinetics, pharmacokinetics defined as you know, the kinetic of drug absorption, distribution, metabolism and excretion. So basically it is called as KADME. So KADME means K stands for kinetic and ADME stands for absorption, distribution and metabolism and excretion. And the relationship with the pharmacological, therapeutic and toxicological response in men and animals, or you can say in human beings and animals. So depending upon the therapeutic objective to be attained, the duration of drug therapy and the dosage regimen are decided. And rational and optimal therapy with a drug depends upon choice of a suitable drug and a balance between the therapeutic and toxic effects. So both are important. Both therapeutic and toxic effect are important, for which we are going to discuss pharmacokinetic principles. So how it is balancing the therapeutic and toxic effect. So pharmacokinetic usually expressed as a PK. So pharmacokinetic basics usually three types. One is clinical pharmacokinetic, population pharmacokinetic and toxicological pharmacokinetic, or it is called as toxicokinetic. So clinical pharmacokinetic, in this clinical pharmacokinetic, it is nothing but application of pharmacokinetic principles through drug therapy in patient care. So in this it is coming individualized dosing strategy, dose adjustment, then patient specific approach based on the pharmacokinetic methods. Pharmacokinetic provide scientific basis for dose selection, the process of dosage regimen design, and helps in dosing in different patient groups to evaluate concentration dependent toxicity, to evaluate lack of therapeutic efficacy. And if you take the example, a common example is dosage regimen alteration based on the creatinine clearance. Population pharmacokinetic. Coming to population pharmacokinetic, it is the study of pharmacokinetic at the population level, in which data from all individuals in a population are evaluated simultaneously using a nonlinear mixed effect models. A primary goal of most population pharmacokinetic modeling evaluation is finding population pharmacokinetic parameter and sources of variability in population. So other goals include selecting observed concentration to administer dose by identifying predictive covariance in target population. That means after administering a dose, and we have to identify the predictive covariance in targeted population. What are the variations are there? What are the variability, and how this different pharmacokinetic parameters is affecting with respect to therapeutic dose or therapeutic level and toxic level. So how it is affecting, all this will be calculated. Then coming to toxicological or toxic pharmacokinetic or toxicokinetic. So application of pharmacokinetic principle in design, conduct and interpretation of drug safety evaluation study. It helps in the interpretation of toxicological data in animal and extrapolation to the human. Then preclinical drug development, it is useful in preclinical drug development stage. Then what are the different aspects of pharmacokinetic studies? There are two aspects in pharmacokinetic studies. One is theoretical aspect and experimental aspect. So in theoretical aspect, which involve the development of pharmacokinetic models to predict drug disposition after administration, statistical methods are commonly applied to interpret data and assess various pharmacokinetic parameters. Then experimental aspect, which involve development of biological sampling techniques, analytical methods for the measurement of drug and metabolites, metabolic concentration in biological samples, and data collection and evaluation. So next, most important thing is plasma drug concentration time profile. So plasma drug concentration time profile is nothing but that is obtained by measuring concentration of drug in plasma samples taken at various interval of time after administration of a dosage form and plotting the concentration of the drug in plasma in y-axis versus concentration of corresponding time at which the plasma samples are collected in the x-axis. So mainly when a dosage form is injected or administered to any either when a human being or animal, at the time with respect to time at different time interval, we have to take plasma samples and analyze how much amount of drug is there. So after analyzing the amount of drug or concentration of drug in the plasma, then we have to plot a graph between plasma drug concentration and time. A typical plasma drug concentration time profile is obtained after a single oral dose of a drug and showing various pharmacokinetic and pharmacodynamic parameters, and it is represented in the figure. So this is the figure we are talking about, plasma drug concentration time profile. So plasma drug concentration is taken in the y-axis and time is taken in the x-axis. So this plot is just like a mountain. So it is having three type of phases. One is absorption phase, next is post-absorption phase and elimination phase. So when absorption rate is equal to elimination rate, the point is called as peak plasma concentration and it is represented as Cmax. And in this we will have area under curve and Tmax, that is the time taken to reach maximum maximum plasma drug concentration or peak plasma concentration. So apart from that, different pharmacodynamic parameters are there. One is onset of action, duration of action, termination of action, and we'll have minimum effective concentration, which that means the minimum concentration of the drug required to start pharmacological response or to start the therapeutic response, and minimum safe concentration, or you can say maximum effective concentration, MAC. So above that, toxic level will be start. So above the minimum safe concentration level, toxic level will start. So initially to start the pharmacological action, the point is called as onset of action, and when the action will terminate, that is called as termination of action. After that, there will be no therapeutic action. So from this graph, you can say three levels are there. One is sub-therapeutic level, next one is therapeutic level, and another one is toxic level. So come to individual discussion. First one is pharmacokinetic parameters. The three important pharmacokinetic parameters that describe the plasma level, time curve, and useful in assessing the viability of the drug from the formulation. So they are peak plasma concentration, that is Cmax, time of peak concentration, that is Tmax, and area under curve. So three parameters. So coming to first, peak plasma concentration, that is called as Cmax. The point of maximum concentration of drug in the plasma is called as peak, and the concentration of the drug at the peak is known as peak plasma concentration. So it is expressed in the Cmax, and the unit is microgram per ml. The peak plasma level depends upon three factors. One is administered dose. If the dose will be more, then peak plasma concentration will be more. So it will be directly proportional. Rate of absorption, that is also directly proportional. More the rate of absorption, more will be the peak plasma concentration. And rate of elimination, which is inversely proportional. That is, if the elimination rate will be more, then peak plasma concentration level or Cmax will be less. The peak represents the point in time when the absorption rate equals the elimination rate. Already I told you, when the rate of absorption and rate of elimination are equal, so that point is called as peak plasma drug concentration, or it is expressed as Cmax. The portion of curve left to the peak represent the absorption phase, that is when the absorption rate is greater than the elimination rate of elimination at the time, that is called as absorption phase. In that phase there will be increase in the plasma drug concentration. Continuously there will be an increase in plasma drug concentration in the absorption phase. The section of the curve to the right of the peak generally represent elimination phase, that is when the elimination rate exceeds the absorption rate. The peak concentration represents the intensity of pharmacological response. Ideally should be above the minimum effective concentration. So the peak plasma concentration, ideally it should be above minimum effective concentration and less than maximum safe concentration. So it should fall between MEC and MAC, that is minimum effective concentration and maximum safe concentration. Coming to next parameter, that is time of peak concentration, that is Tmax. The time for the drug to reach peak concentration in plasma after extravascular administration is called as time of peak concentration. It is expressed in hour and is useful in estimating the rate of absorption. Onset time and onset of action are dependent upon also Tmax. And this parameter is important in assessing the efficacy of the drug. It is to treat acute condition like pain, insomnia, which can be treated by a single dose. So acute condition, disease happening in the acute conditions like pain and insomnia require quick actions. So at the time there should be less Tmax. If the Tmax is less, then the acute condition disease can be cured with a few minutes or means with very less time. It will take less time. Otherwise, if the Tmax will be more, then it will take more time to cure the disease. Then coming to most important parameter, that is area under curve. So total integrated area under the plasma level time profile, which is expressed in the total amount of drug that come to the systemic circulation after its administration. So area under curve is expressed in microgram per ml, that into hour, microgram per ml into hours. It is the most important parameter in evaluating the bioavailability of the drug. So bioavailability is nothing but extent of absorption of the drug, or total, how much total amount of drug that reach to the systemic circulation. So that will be only calculated from the area under curve. After plotting the plasma level time, after plotting the graph between plasma level plasma drug concentration versus time, and that curve we will get, that curve we have to divide into trapezoids. So how to calculate this area under curve, that we have to also understand. So first we have to divide this curve into the trapezoids. Approximately there will be trapezoids, because the curve part we have to make it as a straight line. So think it is straight line. So there will be two other parallel sides, and one will be the height. So height will be represented from the time graph, and two parallel sides will be taken from the concentration level, that is C1, C2, like that. So we have to find out the concentration, we have to extrapolate to the concentration axis, to the graph, and to find out the height, because you have to calculate the area of individual trapezoids. Okay, so area of individual trapezoid can be calculated by the formula half into summation of two parallel sides into height. So height can be calculated by subtracting the higher value to the lower value like T2 minus T1, T3 minus T2, or T4 minus T4 or T3, like that. And concentration, the means how much amount, that height of these two parallel side can be calculated by extrapolating to the c axis, right, concentration axis. Then you have to put that formula of trapezoid, area of formula of the trapezoid, that is half into summation of two parallel side C1 plus C2 and T2 minus T1, like that. Means from higher time to the lower time, then that will be indicating the height of the trapezoid. And in at the beginning and at the end you will get two perpendicular triangles. So first you have to find out the perpendicular area of perpendicular triangle. So what is the formula? Half c into means base into height. So here base is time and height is your concentration. So whatever the concentration you are getting, you have to extrapolate to the c-axis, then you get the concentration. And height you will get, just you take the time, how much time difference of the time. Initially just take the time, and if you're at the end, then T4 minus T3, like that you have to calculate. So if in the as a gist, if you find these three parameters which are most important in design of a dosage form. So three important parameters from the plasma time profile. One is Cmax, Tmax, and area under curve. So Cmax, usually the importance of Cmax is it will decide the intensity of therapeutic response, and it depends upon the dose administered, absorption, rate of absorption and elimination rate. Then it is expressed in the microgram per ml. Then Tmax depends upon rate of absorption, onset of action, it will decide onset of action, and it will be expressed in minute or hours. Then area under curve, it will be the extent of absorption, it will determine the extent of absorption. It is useful in the calculation of bioavailability determination, and its unit is microgram per ml into hours. So friends, thank you. I hope you will get some idea about this pharmacokinetic parameter, because this is most important by designing a dosage form. So in next video I'll come with a new fundamental like thing. So basically we'll discuss different fundamental in pharmaceutical field, because these are the things which will be utilized while designing a dosage form as well as in manufacturing process. So thank you for watching. Bye. See you next time.